I'm going to talk to you about the bicipital tendon and peritendinous sheath injection and the importance of the skeletal anatomy. As you would see here, the bicipital groove is where the bicipital tendon or the bicep tendon lies, and you have the greater tuberosity and the lesser tuberosity. The lesser tuberosity is medially, greater tuberosity is laterally. The bicep tendon is sitting between the two, and then bicep tendon goes up and becomes intra-articular, and that's another area to target for the intra-articular injection with anterior approach in the rotator cuff interval where the bicep tendon has become intra-articular. To perform the bicep tendon injection, the ultrasound probe is placed on the top of the humeral head, where you can see the greater tuberosity, lesser tuberosity, and the tendon. The clinical pearls here always put a color Doppler looking for an artery, which is the anterior circumflex humeral artery branch. The artery is usually placed laterally, so to perform the injection, I prefer doing it in plane, coming from medial to lateral, and don't inject the local anesthetic and steroid in the tendon. It's basically for the tendon sheath rather than the tendon. Injecting the local anesthetic and steroid in the tendon will lead to the rupture of the tendon, so only inject it around the tendon. Going to show you the bicep tendon peritendinous sheath injection. To perform the procedure, the patient will be sitting and with the arm supine or neutral position. You will feel for the upper part of the humerus, and you will be bringing the ultrasound probe, resting it on the top of the humeral head, looking for the tuberosities. As you would see here on the ultrasound screen, we have medially the lesser tuberosity with the subscapularis muscle. The way to prove it's a subscapularis muscle, you can actually move the patient's extremity externally, rotate it, and you'll be able to see the subscapularis muscle. Here we have the lesser tuberosity and the greater tuberosity, along with the bicep tendon and the transverse humeral ligament, and you will also have the pulsations of the circumflex humeral artery. I'm going to put a color Doppler to show you that the pulsations are there, and I'm going to freeze the image. To perform this injection, my recommendation would be to come with an in-plane technique, going from medial to lateral, or you can do an out-of-plane technique, inject in the peritendinous sheath. With regards to the ultrasound image, we have lesser tuberosity, which has a peaked appearance, the greater tuberosity, which has a round appearance. This is the bicep tendon, this is a transverse humeral ligament, and this is the ascending circumflex humeral artery branch. Bring the needle in plane, coming in from medial to lateral, and go below the transverse humeral ligament, and you will be injecting about 1.5 to 2 cc's of local anesthetic and steroid mixture. The muscle here you see is a deltoid muscle.